I'm really excited to announce Karen Hanson, the second recipient of our CWB Wealth Indigenous Health Scholarship. The scholarship has been created in partnership with our client, ARNET, that we've had for over 20 years. ARNET is otherwise known as the Alberta Registered Nurses Education Trust. Karen, why did you decide to go up north and work on the reserves?
So I had decided to go up north when I got to that 10-year mark in my unit, and I realized that I really need to do what it is I want to do, or I'm going to be here forever. I was always very interested in Indigenous, and I always wanted to go up north. I just didn't know the avenue how to get there. So, and then it fell in my lap. It was almost like a sign, and this job opening was there, and I jumped on it. I was always very interested in Indigenous health. As a child, I had a neighbor. Our neighbors are 4 kilometers away, but that's neighbor. And she was a girl the same age as me that had come into our community, and I had never seen anyone who wasn't white or black. And she was Inuit, and it really caught my interest as to, where are you from? As a child, I couldn't help but want to study her, want to know more about her, want to know more about where are you from, what's it like where you're from. It was always very interesting to me, and I really wanted to learn more. And then through the years, I learned more just on the outside, but as soon as I was able to get a position to go up north, I was definitely jumping on it.
So can you tell me what what your work up north on the reserve is like? What's a normal day like?
A normal day is seeing a lot of children. So you'll go to the clinic, and it's all walk-in for the most part anywhere you go. I'll see somewhere around 12 patients during that day. During that day, we'll see the children, see the adults, it's all ages. I will call the doctor, or I'll call the NP to consult with them. And then I am the lab, so I draw the blood, I give out the prescriptions, I explain everything to them. If there's a critical patient, then I'm medevacing them out of the community to go to bigger hospitals, because we don't have doctors that are in our communities with us. Some communities in Ontario do, but just not in Alberta, BC, for the most part. And yeah, your day kind of begins like it's 7:30 in the morning, but your day can go, I can easily have a 16 or 19-hour day when I'm up there. And that's why you do 2 weeks at a time. Doing more than that is very difficult.
Karen, what are some of the misconceptions you'd like to debunk about healthcare on reserves?
So some of the misconceptions is I want people to understand the obstacles that the people on the reserves have for getting healthcare. So they need to understand that when we can just go to the pharmacy and pick up some cold medicine for our kids or things like that, they don't have those options. So we have to order things in specially, or they have to try to buy it at the store if they have it at their stores, which are very small and it's very expensive. Just to see a healthcare nurse, perhaps there's not enough of us there. Perhaps they're short-staffed. They've had times they had to close clinics for emergencies only. And then if they want to see a doctor, it's either going to be telehealth, which is great, but not the same, or it's going to be medevaced out to a hospital. So they have to leave their families. They have to leave everything behind to go out of their community to go see a healthcare practitioner. Then when they get there, you never know what kind of welcome that they are going to get. So it's just, there's a lot of racism in the system for them. They have a lot of obstacles to go through. So people need to understand that it's not easy. It's not like you and I just going to a walk-in clinic and then we just get everything we need. There's x-rays, there's testing, there's so much that needs to be done, and everything has to be organized 100%. How am I going to fly you out for this test? How are you going to get childcare when I send you out for this test? And then how are we going to get you back? And it's, where you're going to stay when you're there. It's so much that people don't understand.
Yeah, sounds like it's never a regular 8-hour work day when you go up there.
No, it's never a regular day.